Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Last week's primary elections were an important opportunity to make our voices heard on behalf of rural health in our own communities and across the nation. As new individuals prepare to start their terms, rural health needs to be top of mind. No matter who is in office, supporting sustainable healthcare services for remote communities should be a priority, and our local, state, and federal representatives rely on constituents in those communities, including healthcare leaders, to share their stories. If you have new representative in state or local officials, get connected with them and let them know what rural health means to you. On to the damage report. A recent report from Trek Health and the Healthcare Financial Management Association shows that contracts between payers and hospitals don't reflect payer policy changes, resulting in major revenue leakage for healthcare providers. According to the survey, 64% of hospitals are seeing inconsistent payment practices from payers, and 42% experience changes to payment methodologies or logic. With rural hospitals struggling to maintain a margin, payer transparency is more important than ever. The report also shows that more than 60% of hospitals expect reimbursement shifts driven by payer rate, policy, or methodology changes. When hospitals have to negotiate with payers based on limited available price data, analysis, and leverage suffers, giving the upper hand to payers at the risk of proper reimbursement for the cost of care. This report reflects the power disparity at work in hospital-payer relationships across this country. Smaller rural hospitals are at greater risk due to the higher populations of Medicaid and Medicare, which come with non-negotiable reimbursement models. These hospitals also don't have the same resources as big system urban healthcare to contract third parties for payer negotiations and revenue management. To ensure the future of sustainable healthcare, we must not only hold accountable the providers of vital healthcare services, but the agencies responsible for transparent policies and proper reimbursement. And now for today's success story. Unhoused populations in rural communities can often struggle to access basic needs, including food, housing, and preventative care. Rural Health Services, a nonprofit organization in Aiken County, South Carolina, recently held an event called Healthcare for the Homeless. The purpose of the event was to address short-term and long-term concerns of unhoused community members, connecting them to local resources and agencies. Event attendees also received a free lunch, hygiene kits, HIV testing, Narcan, and blood pressure checks. Stories like this one show how vital community agencies are for the overall health and well-being of small towns. Thank you to our sources for this episode: Becker's Hospital Review, Healthcare Financial Management Association, and the Aiken Standard.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.